So good afternoon, everybody, and welcome to this week's blog on events and festivals and some of our public health indicators. Gemma, welcome again. How are you?
Good, thank you. Hope you're all well.
We'll go through some of the figures as we normally do, and just to remind everybody that back in March, April time, Warwickshire partner agencies came up with a series of risk indicators to help event and festival organisers in terms of their planning and decision making. And we'll talk through some of the figures that I've set out here on this slide as we have done on previous blogs. So without further ado, I'll hand over to Gemma.
Thanks, Jonathan. Okay, so I'll try and share my screen. I always try and do this more smoothly than the last time I tried to do it, so we'll see if that happens.
Done well. Well done.
Oh, brilliant. Okay, that's a good start. Right. Okay, so I'm starting as I usually do, and I'm showing the rolling rates per 100,000 population of positive COVID cases across Warwickshire. So as usual, each colour represents the different district and borough. For example, pink North Warwickshire, purple Nuneaton and Bedworth, and so on. The blue dotted line is the Warwickshire average. So as you can see here, we were aware of a large peak in cases, not surprising with the unlocking of restrictions. We're now seeing a decrease in those cases. So if I just zoom into the last 3 weeks, you can see it a bit more clearly. So here we are witnessing across the patch, a nice rapid decrease in cases, bringing the sort of Warwickshire average down to, got here 372, whereas it's been ever so high. It's been sort of 611 over the last days and weeks. So that's really positive. And I will show as well the vaccination uptake as well. So what we're seeing in Warwickshire is we've got 82% of the population having had their first vaccine dose and 67% having had their second. So that's still increasing, which is really good. You can see obviously the age categories here. We've got some younger age categories that have come to light now. So looking at 15 to 19 and 0 to 14 as well. But if we sort of look at our age 40 to 49s is still progressing and still looking good. 30 to 39s and 20 to 29s, again, it's just a little bit lower than we would hope, and we do understand that it matches the national trend of uptake being a little bit lower and perhaps slower in those age groups. So just really encouraging uptake in those age groups, especially as we move along. Further things are restricted, perhaps further need for entry and things will be happening with regard to having 2 vaccines. So really important to start pushing those in those who haven't had a vaccine yet. So I'll just come back onto the main screen and stop sharing.
Just in terms of hospital admissions, have we seen much in terms of an increase in hospital admissions or those in ICUs?
Yeah, so with regards to sort of general COVID patients in hospital, so beds occupied by COVID patients, or those suffering with COVID, even whilst they're in hospital for something else, you're looking at a sort of a steady increase. There has been a steady increase over the last few weeks, in line with what's been happening in the community. So nothing unusual or unexpected. Looking at those trends, and then when we look at the ICU beds, we see small, very small number of sort of increases, very single figures, excuse me. So yeah, so we just kind of see a very small increase there. So nothing alarming, and nothing that's putting mega increased pressure on the services.
Yeah. And I think the spikes that we were seeing in June and into early mid-July, I think we've had many conversations, haven't we, Jenna, in terms of what has been driving that. And I think our view probably is it's a bit of a connection between people taking advantage of the fact that they can meet wider groups in social settings. Certainly certainly some of the interaction within the school environment was having an impact. I know schools did a fantastic piece of work in trying to minimise that, but that combination of that kind of social mixing, the schools, and some of the work around hospitality connected with the Euros. Probably, there's not a single element, but there's the combination of those different things, I think, would probably where our assessment would be. Would that be fair?
Yeah, for sure.
Yeah. And when we've looked at the festival and events that we have taken place, that we've worked closely with festival organisers through those summer months of June and July to date, we've not necessarily seen any significant increase connected with those events, and certainly, I mean, I think our assessment, again, just Gemma, just to confirm that you're of the same mind, our assessment is mainly the control measures that festival event organisers particularly put into place, those extra control measures like LFTs, increased use of outdoor space. We did a lot of work with a number of festival organisers in terms of increasing tables, chairs, the ability to eat in outside arenas, minimising enclosed areas, so taking sides out of tented areas where people would go, and so you have increased ventilation, and controlling the flow of numbers as they were coming through. All those were really positive, weren't they, in terms of those events, and they're things I think both of us would like to see replicated if you're planning an event. So
Yeah,
is that fair?
Yeah, definitely. I think all of those measures, event organisers have been brilliant. We know what works. And we're still obviously in the kind of gradual coming out of restrictions phase where things are a bit sort of unsteady and potentially unknown. So I think it's still really important to pay attention to those measures, LFT testing in particular, picking up on infections. So yeah, no, I think it's just continue with the good work that we've been seeing as we move forward, definitely.
Yeah, and to pass a really big thanks to those festival and event organisers who've worked so closely with us and taken on board the measures. And as I say, we've seen some really positive results for those. So thank you very much. I suppose the big message then, if your festival or event has got people, or your target audience tends to come from that slightly younger age range, the kind of 30s or unders or 40s and unders, then please come and talk to us. We'll probably would like to, with your help, to encourage people to get vaccinated at the earliest opportunity, whether that's the first or second dose. We'd love to push those figures much up to and over the 80% mark. So if you are particularly looking at that particular target audience, and you can work with us to encourage that would be absolutely fantastic. And please come and talk to us if you're an event that's drawing an audience from across the country. We can definitely give you some information on what rates look like from certain areas, so we can give you some comparisons, or give you information of where we think high rates are, in case you have information on where your audience is coming from. So please come and talk to us. Thank you. Emma, is there anything else you want to add on those points?
No, nothing else from me. That's great. Thank you.
Good. So thank you everybody for listening in, and we look forward to catching up with you next week. Have a great weekend. Take care.
Bye.